I chose this career field because I have always had a passion for working with people. I didn't necessarily have experiences working with individuals with disabilities, but there was just this real knack to work with people.
It's one thing to be behind a desk and doing a bunch of stuff and typing on a computer, but I really like hands-on working with residents. They just light up my day.
I just love being with the tenants, getting to know them, their families. Sometimes you are the only one that they have in their life, and just knowing that you give your all and that they are in good hands.
I chose this career field because I like working with people. I like working with the general public, and I've always wanted to work in healthcare. I feel that working in healthcare is a very stable career. It's something that's always going to be around.
To be honest, I never actually thought I'd get to be in the nursing position I'm at right now. I realized that my personality is a caregiver personality, so that just motivates me, and it actually surprised me. I learned a bit about myself by becoming a nurse.
I think my favorite thing about it is you're so busy and I'm so involved with each tenant that your day flies by. You don't necessarily feel like you're always at work. It's more so, what can I do to better their day?
Helping others is just what I do. That's just who I am. I do that in every area of my life. At the end of the day, I feel good about myself because I know that I've made a difference in somebody else's life.
I think you have to be a determined person to work in this career field. You need to be a hard worker. You need to be able to look past your own needs to be able to meet other people's needs. I almost feel like you almost need to be a little bit selfless to be able to work here. Just because your whole day is revolved around making sure other people are able to live their lives the same way that you're able to go home and live your own life.
I would say my favorite thing about working here would be just getting to help people in their daily lives. You know, going out and doing simple tasks that we take for granted, just being able to aid them every day in that is very big to me. It's very rewarding.
We try to provide different activities that make them feel happy, brings a meaning, purpose to their lives.
We not only get to provide them with meals at breakfast, lunch, and dinner, we actually get time to meet them, meet the family they bring in, or the guests, their friends that they bring in. They want you to know who they are too, as a person, not just as a resident here.
The best thing I like about my job is helping patients. We get to see them before surgery. We see them healthy as a patient afterwards. And another part of why I like doing what I do is the technology. I like the hands-on. It's always changing. You're always learning. It's never the same when you come to work.
Well, the medical industry in Winona, we have so many different avenues that you can go with that, from nursing care to primary care to our hospital to any sort of assisted living and independent living. There's so many career opportunities that you can have here, and I think a lot of people don't understand that it is here.
We have people who do housekeeping. We have specific people for laundry. We have maintenance. We have culinary. We have everything that you would need in your life is kind of in this small ecosystem of a building. And it's important for people to understand that.
Well, as the baby boomers retire, there are many job opportunities out there, and we are actually facing a nursing shortage right now. And so there will always be opportunity for advancement if you enter the healthcare field.
So in this area, even just with a high school diploma or any kind of nurse's diploma, you can definitely find plenty of jobs. There's nursing homes, there's all sorts of different clinics, places like this where you get to work one-on-one with individuals in their settings or in group homes. Lots of different opportunities in the area to go with.
I went to Winona State and I graduated with a degree in social work, but we've also had individuals that will get their first job in high school and have stayed with the agency long term.
I started out as an aide, but my director, she just told me that I should transition into the role of nurse, and they've given me so many opportunities to succeed in my position.
I chose to attend Southeast Technical. First, I took my CNA class at St. Anne's, and I ended up going for my LPN, and then I worked as an LPN here at Winona Health while I was obtaining my RN.
If you don't think that there's opportunities in Winona, you're probably not looking at the right places. So I think that there's lots of opportunities, you just need to know where to look.
I was not very familiar with Winona at all before I did start working here, but now that I've been here and gotten to know the community, I do see all the opportunities that are available for me here, and it makes me excited for my future.
I really didn't know what to expect. I was scared that I wouldn't understand residents or how to take care of them, and now I've just formed so many relationships with so many residents. It's just been really great to be in the healthcare experience.
I think jobs in healthcare are just the most rewarding thing that you can do, on this earth.
To me, healthcare means improving the lives of others.
Caring.
Compassion.
Selflessness.
Patience.
Rewarding.
Enriching the lives of people.
Daily support.
Love.
Sharing a wealth of knowledge.
Community.
Support.
Treating everyone as family.
Fulfillment.
Caring.
To me, healthcare means compassion.